All right, good morning once more. We'll start from where we stopped in our last class. We are still on the course BDT 152, Basic Dispensing Theory 1. And in our last class, we continued with suppositories and pessaries. So today, we go into the advantages and disadvantages of suppository. But before we do that, you know, when I enter the preparation of suppository, you come to understand that just like other dosage forms, it also has the active ingredients and other excipients. Then I told you that here we made use of bases, just like maybe when you do liquid dosage form. I think this is what you did in your first year, at least for mentioning sake. Liquid dosage form, you talk about the vehicle and other things. So here now we talked about the base in which the other ingredients are incorporated. Am I communicating? Now, here, apart from the excipient and the base and the other excipients, we have active ingredient that can be used for treatment of local infections. Some of them contain active ingredients used for treatment of local infections. We mentioned examples in our last lecture. We talked about vaginal infections and candidiasis. Did you mention candidiasis here? Yes. For pessary, right? Then we talked about even for, there are some used for, some that are used for maybe to treat, have you heard of Ducolas, Bisacodil? Yes, sit well. Please, let's learn how to sit in class. It's very important, please. Now, Bisacodil, Ducolas, the active ingredient in Ducolas is Bisawat. So this Bisacodil, you can also see it in as a tablet, 10 milligrams or so. You can have it as a tablet. What does it do? Good. It's used to treat patient with constipation, right? Now for patients that find it difficult to maybe to defecate, you can have it as suppository. They will insert, right? They will insert. Now, is there to do what? Help the movement of bowel movement, to influence bowel movement. So the point I'm trying to make here is that we have other active ingredients incorporated in the suppository, just like we have in other dosage forms. Now, having that in our mind, come here. Oh yeah, asking water, I don't know if you enjoyed being. I don't understand it. But what is there in keeping simple instruction? You are a student here. Just keep to the instruction. Simple. You are looking for who you say that is wicked and who is not wicked. When you cannot keep simple instruction, when you are told leave the class here, don't enter again, this person is wicked. You forgot that you refuse to do what you should do. I don't understand it. No wonder even God regretted creating human beings. True of us? True. But, okay, he didn't. Okay, what happened? Tell us. No, tell what happened. He said for tell us what happened. Who said he got this? So making noise. You're making noise. So what happened there? So what happened there?
In the book of Genesis, God looked at all the things He has created and said, "It is good." Yes.
You are making noise. You are making. See, I hate noise. Listen. You guys should go to the level of you start making noise. If you have points, shut up and make your point. Stop making noise. You're shouting. If you think what I said is wrong, stand up and prove me wrong. Simple. No. Don't make noise. Then, before you do that, search God. Did God ever reject a creative mind in the Bible? Search it first before you talk. Huh? No, did God ever reject it? Read, please. Stop making noise. Read it for us, please. You make noise. No, I say something. People are making noise. Why are you shouting? You're just making noise. Please grow. When someone says something, hello, don't be sentimental, don't be too emotional. If someone says something, sit down and reason what the person said. Then if you have points, make your point. You are shouting yes. Those that have written, if you have read it, tell us where it is in the Bible. Let's see whether it's true or not. We are too difficult to handle. Why? Read for us.
And he requested that the Lord that has made man on earth, and he grieved him at his heart. And the Lord said, I will destroy man, whom I have created from the face of earth, both man and the beast, and the creeping things and the fowl of the earth. For if it repented, that I have made.
See, listen carefully. See. How can God that say that everything is good see, human being is onto one funny creation. That thing you are asked to do, they will not do it. It's why you ask not to do that He will do. Even though it is like that, we can still change it. Try as much as possible to be reasonable. So please, let's stop this lecture, okay? If you say it's not true, there's no problem. There's no problem. We are not here to argue whether it's true or not. If you say it's not true, that God will not regret, fine, it's okay. Let's continue our lecture, okay? All right. I just mentioned it as passing because I sometimes sit down and wonder what is going on. Human resource management is the most difficult job to do because human being is funny creation. Very, very funny. They will create problem and look for who to blame for the problem they created by themselves. Now let's continue. Now we look at advantages and what? Disadvantages. Remember we say that advantage talks about the edge it has over what? Dosage form. For the administration of a particular what? Drug. Am I communicating? Good. Now let's continue. Let's look at this. Now let's look at the advantages. So number one, if you look at this thing, it's in circular form, right? It's in pictorial form for you to understand it better. On advantages now there is a situation whereby oral route of a drug is not what? Useful. Am I communicating? Yeah, you use what? Suppositories. Let's assume now there's some drug that you can. Maybe the patient. Let's assume a patient that has maybe a particular localized infection, maybe in the vagina or even in the anus, or anywhere that's maybe pile or hemorrhoid. Now you know that maybe there's a pain there. The one that will help to take care of the pain, you will insert it there. If you not, maybe by the time the one that the person will take it orally will start going down and start, you may not even get enough milligram to take care of the pain that is localized here. You see that using oral one is not even that useful. The one that is better is the one that you do simply do insert that place, or maybe somebody that has maybe candidiasis, vaginal candidiasis, you want to treat it locally. Of course, the first line is to treat it locally. If you start going systemic, if the patient, maybe the patient didn't handle it properly. Now maybe it's started from itching. The person didn't want to take it seriously, or fulfill on one that not happening. From itching, he started smelling. The person didn't even bother to. Next thing, he started having discharges. Now, at that point in time, you see that using only local treatment alone is not enough. You have to include what? Systemic, maybe tablets, fluconazole capsule, in line with the one you inserted to treat the infection. Sometimes you may even start including, like even metronidazole to take care of what? Some anaerobic infection, bacterial infection. Now, you see that such patient, in this situation now, you need such. Or not just maybe presented with only itching, just itching. You don't need to worry yourself trying to. You must not start using. You can just localize. Yes, it's okay. You can give, but it's not that useful because what you need at that point in time is to do what? Insert. True of course. Insertion. Now you see that EJNB is not that useful because this insertion can do what? Take care of it. That's the point I'm trying to make here. That when the oral route is not what? Useful for a particular treatment. You can use what? Suppository. Am I communicating? Now, it's an edge over what? Now, also, maybe the patient that has such infection, instead of you to give insertion, you start giving the one it will take and neglect insertion. You may not be able to treat it. You may not be able to do what? Treat it. Yes, it's possible. So, number one is what? Is used when the oral route is. It can be used when the oral route is not what? Useful. Then another one is that when patient has some maybe gastrointestinal tract problem, GIT problem. Are we communicating? That means when a patient has some GIT problem, or even post-operative issues. I hear that there are some after operation. The operation has to do with gastrointestinal tract. After operation, the patient may not be able to even swallow anything properly, let alone digesting and breaking down and being assimilated into the system. Some patient may not be able to do that. In such a situation, the best option is to do what? If the drug is in what? If you can formulate the drug as a what? Suppository. Apply what? Suppository to take care of the problem. You may not go and start giving person because if you enter the mouth, if you still need the walls of the intestine to do what? Take it in for you to exert its effect. Now, some patients with GIT problems, of course, some patients with GIT problems cannot absorb food. Hope you know. Most of the patients, there are some problems with GI that you cannot even absorb anything. Am I communicating? So, in such case, suppository may be an option. Am I communicating? So, patient with what? GI T problem or post-operative issues. Am I communicating? Or post-operative. You know what post-operation is? I think I mentioned it here. Now, another advantage is this. In very young, it can be used in very young, very old, or mentally disturbed patients. Hello? Very young, very old, or mentally disturbed patients. There are some tablets. There are some analgesics, even antipyretic that they formulate as suppository. They will insert in the baby's anus. I'm not competing. And in some adults that may not even swallow, but they need this thing, they can insert it. Am I competing? Some mentally disturbed patients that don't even know what is drug. They can't even know. They don't even know their left from their right. And sometimes it may not necessarily be that. It may not necessarily use injection. Only just to the nurse or caregiver may just get the patient. And the person is to make sure to target the patient. Target. Angudia boy aboye you can make it. Sonia the same. Majabezia. Am I communicating? Because the best would have been injection, but there are some drugs that you cannot have as injection. So I just to target the person. Angudia. Abodia. I can. GD of more. Another about kind of GD. Sonia the same. Or the Jabezia. Okay, the Megan Jabezia. Or go on alone. We are in here, he won't take it. He won't even know what to do with it. So that's what it is. It's also good for patients that are mentally what? Mentally what? Stop. Now, Now, there are some drugs also with GIT side effects. Yes, there's some drug with what? GIT what? Side effects. That such patient, maybe a patient has a maybe it's an ulcer patient, for example now. Maybe a patient is an ulcer patient, and then you cannot. There's no maybe they don't want to use maybe something like diclofenac injection. They may say, okay, let's use diclofenac suppository on the patient. Am I communicating? These things are decisions taken by the clinician, depending on what the clinician needs on the ground. Am I communicating? They may give what? So some drug with what GI works. Side effect, good. GI gastrointestinal side effects. What is it? I don't understand. You see GI, you don't understand, or side effect, you don't understand. Let me understand what you don't.
With GI side effect. What happened? The drug with wait, I want to understand something.
Okay.
The drug with GI side effect, so it cannot be given to patients.
There are some drugs that may have some. I say that this decision is taken by the clinician. Maybe having clocked a patient, maybe you realize a patient, maybe for example now I use ulcer, and if the patient has a serious ulcerated mucosa that you don't even need to bring anything NSAID close to it at all. Am I communicating? Now they may decide to use suppository. They can also use injection, but you may look at there are other factors that may make them not to want to use injection. Maybe a patient he will take injection on SATA. The patient are you aware that some patients don't like injections?
Yes.
So what are you going to do? Your mission is to treat this patient. It's not true. Any means you look for. That's why you should be versatile. Look for any means possible to deliver this drug inside the patient body. That's your mission, not your. Your mission is to look for any means to do what? Send this drug inside the patient's system. And the patient has ulcer. You cannot go through the mouth. You can even give suspension. And the patient don't like anything that will penetrate his or her vein. But your vision is to treat the patient. What are you going to do? Open that the drug can be formulated as what? Suppository. Wisdom demands that you should use what? Suppository. You don't be there. So far then, when any other means, unless there's no other means to deliver this drug, that's when you now start becoming a preacher and start preaching for the patient to accept. But once there is still another means you can do that. You say, okay, if you don't want it, okay, it's easy. Just use it. Auto. The person may accept that one. Am I communicating? Good. Because all the same GIT effect that may give you from normal oral one by other injection, which the person cannot take. So you can resort to what? Suppository. Are you okay now? Good. Now, there are also some drugs. All right. Suppository can be used as a form of delivering some drugs. Suppository can be used as a form of administration or demonstration. Suppository can be used as a form of administering or delivering. Can you put yourself? Demonstrating. I combine the two of them. It can be used as a form of delivering or what? Administering maybe a drug that are not stable in the what? GIPH. Of course, there are some drugs when they come in contact with GIPH, they do what? They will not be stable. They are destroyed. I'm not committing. Some drugs that are not stable at GI what? pH, GIPH, or even there are some that are even susceptible to what? Enzymatic attack. Once the enzymes in the stomach get they just destroy it. So I made 2 points here. Some drugs that are not stable GIPH and that are susceptible, that they can easily be destroyed by enzymes. So that are susceptible to what? Enzymatic what? Attack in the what? GI tract. So you do for a way to boycott what? GI. You can, if the drug can be formulated as what? As what? Suppository. You can use the suppository form. Am I communicating? Susceptible. 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 Let me not waste our time on writing on the board. Gastrointestinal.
GIPH.
Yeah, gastrointestinal pH. Gastrointestinal pH. GI means gastrointestinal now. So it can be supposedly can be used to administer or the deliver drugs that are not stable at GI pH, or those that are susceptible to enzymatic attack in the what? GI tract. GI tract means what? Gastrointestinal what? Tract. Now, there are also some drugs. You've heard of first pass metabolism, right? First pass effect, right? Yes. Good. So there are some drugs that undergo what? First pass what? Metabolism. So it's not used for such. It can be used to formulate such drugs if it's possible. If the physiochemical properties of such drug is okay with what? Formulating as what? Suppository. Your aim is to boycott the liver. True or false? Because most of the things that enter the mouth must end where in the what? The liver. True or false? So when they end the liver, so if the drug is undergo first pass effect, once they enter the liver, they will what? Destroy. So to avoid this drug getting in contact with the liver, you can formulate it as what? As what? Suppository. But be careful. That's why you should also be careful the way you insert it. But that's how you will insert a suppository so deep it will end up in the liver. Hello? That's how you push it so deep it will still end up in the where? In the liver. Are we together? Are we together? Good. If the drug undergoes first pass, if it passes to liver, it will be destroyed by the liver enzymes. So that means before it will enter the system, what go waste. So because of that, now you try to do what? Bypass. I think you should do this in your AEM. 1, 2, 3. Yeah. And the examples of such drug, right? Yes? Right? Good. You should know the examples. Examples are what? Number 1. Is that what you are taught? What else? Drugs that undergo first pass metabolism. Are you asking me? I'm asking you. You are taught that. Tell me. Are you Kuzubigi? Are you Brazil? Where do you get the information? Please don't allow anything that is mentioned in a class. Listen carefully. Anything mentioned in the class, try as much as possible to look, at least go through that thing, get more information on that. Am I communicating? That is the simple secret. Once you hear first pass metabolism, you don't even need to be told. On your own, go. Check it up. Pick 1 or 2, 3, 4 drugs that are undergoing it. Put it down in your notes. Expand. Okay? Expand. Okay? Expand. So how do we administer nitroglycerin? Does it make sense to you now? So if you administer solution, does it get to the liver? Does it get to the liver? No. So how does it go from the sublingual here? Who can tell me? From the sublingual, where does it enter and how does it move? So where? Akụzie ife in na hostel mechie akwụkwọ gị chagharịba ya na hostel. Browse it. Make up your notes. Browse it. Make it up. It's very important. Because some things may not actually be, some things you meet in practice may not actually be exactly what you are taught in class. Is the rate, how you develop yourself that will. Most of the things I teach you here is not what I was taught in class. Sometimes they just mention one or two things. Go according to the in as a magazine. Look into it. Get more other information about it and develop yourself. So now let's go. There are some drugs that are unacceptable. Drugs that have what? Unacceptable tests can be administered as what? Suppositories too. Am I committing? So apart from coating it, apart from coating, when the patient that even if you coat it, actually, you coat the end, you coat them, and they don't want it, but they don't do what? They don't even want to bring it close. And you could so to avoid that, you being a clinician, I want to help your patient. Remember we talked about compliance. What you need is what? Compliance. Other possible step. If the patient will be in your office, maybe wine, we give me wine anyway. But the point I'm trying to make is this: look for a way to, other possible, if we need like to administer it, so you the thing, if possible. If possible. Yes, there are some patients that cannot do it. True of us. Yes. They cannot do it. So, if possible, help the patient. If possible, anyway. Now, there are some drugs that may be abused as in what? Suicide. Hello? 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 There are some drugs that may be what? Abused as in what? Suicide. Now, there are some drugs, there are some patients. There are some drugs that may be they not even know that is in what? Suppository what? Form. Are we there? Are we there? Their mind will not even go there. I'm not convinced. Unless my mind of more they cool down. What you are sunny tiumia, ochiosia, nausea, conmusia. Except for such people, but majority don't even know. I'm not communicating. So they won't even see it to even swallow. Let alone taking it. I'm not communicating. I'm not communicating. So such drug, they can formulate it as that and keep. That direction, they may even go. I think they don't take this one or they put it in the anus. Am I communicating? So for some drugs that may be abused, mark the word abused, as in what? Suicide. Such drug can be formulated as what? Suppository, even though it's not common in this part of the world, even though it's gradually becoming common. It's gradually becoming common. Everywhere, all this too much, bro. The Western world, Western world, they have everything they need. So because like any other, you boom here. Oh yeah, I go now. Next day, no, you can. Oh yeah, I go now. Next day, what you're thinking is, can you come into where what you going to need that? I see because no one they going to get more. Can you do think you would need? Are they ready to no, you first go looking. Make sure you can get that. Suicidal. Anyway, it's not you. Anyway, frustration can cause it anyway. Only frustration man can no one. Only with hope. But in our it exists even among those that you think that things are okay with them. This suicide issue is common among those you just want to be like them. But then on I am motor wenka on the that want to be like them, and you won't know what they are passing through. So what about depressed? Do you want to look name and you want to be like them? Am I communicating? So the point I'm trying to make is this. No, I go. Let go do. No, off pocket kwa baro no get good in kebuni ligodo okpa. You do mila for. You be thinking of what to do now, what else to do now. Obuli no na nature maka onye no be nkawa nkawa. Otusu she's not calling me on phone. She's now with another man. Obuli so what's the goal looking at you that? Now all you feel what's the goal look anyway. Makano what is it? Now these are the important advantages of what? So the egg it may have over. How many are there? How many that call?
7.
Find out more. Find out more. Now let's look at disadvantages. Let's look at what disadvantages. My phone is about to go. Now let's go. Now, remember I say that when you mention disadvantage, you talk about the edge where a situation where you cannot formulate the drug as this. True of us. Where others to do it from is also better. Is it clear? Yeah. That's what when time we hear disadvantage, this is what should come to your mind. Articulate situations or conditions where you cannot use this, where others can be what? Used. Now let's go. Now here now. You know we have of course now direct to where you are starting with Medina. They also have mucosa too, right? Yeah. There are some times that maybe irritation of the word mucosa. I'm not getting. So there's maybe an underlying issues with that person or maybe a physicochemical property of the drug itself that it can cause mucosal irritation. Because you know that these things are in contact with the rectal, it gets in contact with the rectal mucosa. True or false? Or vaginal mucosa. Am I communicating? What are you talking? What are you talking? What are you talking? Practical work in my class. That's wrong. Very, very wrong. You don't do that. Please. If that's in your copy is important to you, go there and be copying it. And this is very important, more important than this class. You can go there and copy it there. I'll connect you. You are free. I cannot force you to say my class. Yes, I don't do that. But I know how to humble you. In the arrogance. So if that thing is more important than this class, you can go. But don't stay and be doing that. It's wrong. Now let's continue. So if the drug has its own physicochemical property inherent to it, it can cause irritation of the mucosa. Because it comes in contact with this thing. You say no, this drug can cause what? Irritation. Let us not use it, or let us not even formulate it as what? Supposition. Am I communicating? Or maybe a patient instead has a prevalent issues. You can also do what? Not use what? Supposition for that what? But so summary that we have, if there is tendency of what? Mucosal what? Irritation. Am I communicating? Is also a disadvantage for what? Suppository what? Dosage what? Form. And also there's another one is traditional issues. Don't when do men and have now. Yes, traditional issues. I've seen things now. I've worked in different places. I've worked among Muslims. I've worked there. So I've seen things that is not in here. It be something somewhere what else. So these are traditional issues. Traditional issues, feeling of what? Aversion. What is aversion? Check it up. What is aversion? Check it up now. Aversion is what? I told you to read that here. So if nobody has actually browsed, that means you know that go by this part. Young is making. So what is the phone to do? Take it up now. So are you there? So there are some solutions that you don't do that. I'm not completing. Or depending on the level. Are we there? So if you may counter just keep because they buy there if you man or issue to them. or when the other day see any opening in alpha, or bullet issues to them, true or false? So, because of some traditional issues, example, feeling of what? Aversion. So, in such situation, you may not use what? Suppository. Now, leakage. Sometimes there may be what? Leakage. In the word suppository. Maybe the suppository is already about melting. Maybe although well stored, it happens. There are some people that actually more those in una coffee, safety that's right. Actually, man, they will even convince patients to use it. No. It is here. Obelogu. Come on, guy. Emet baby ni. Osiki na wasunana. Will they actually enter the system? Will it work? You don't even do local effect, let alone systemic. True or false? So in such situation, you look for a better what dosage form that can do what administer the word. It must also come from the factory, from the manufacturers. Am I communicating? It can also come from the what manufacturers. It can also come from the way the patient inserted it. True or false? So a lot of factors can lead to what? Leakage. So in such a situation, you don't use what? Suppository. Am I communicating? Then sometimes a problem that may occur. To avoid all those issues, you can use a better. Maybe you suspect that this patient, or maybe you gave the patient the first one, you used it, you came back, start complaining that you treat anana. You now started questioning the patient. You realize that the patient didn't use it well. Instead of using it again, you go for a better word, one that will give you what you are looking for. It's not true. Yes. Now, sometimes because of probably due to how they manufacture the suppository, or maybe due to storage issue, or maybe most especially how the patient is inserted it, there may be incomplete absorption. True or false? There may be incomplete of course, can leakage lead to incomplete absorption? Yes. So there may be incomplete absorption. In such situation, now go for a better word. This one that will give you what you are looking for. Then there may be inter and intra-subject variation. Inter and intra-subject variation. This one has to do with. This one has to do with. I don't want to go deep, but I just want to be that the way patients, there's variation in the way patients respond to some dosage forms. Am I communicating? Now there are some patients that even if you give them the same thing, the same dose one, the way it will absorb the active ingredient from that suppository may not be exactly the same thing. Some may do differ. Some even their absorption profile may not be that wonderful. Am I communicating? That one you may not notice that one. This one is rarely noticed anyway. It may not be obvious. It may not be obvious. This particular one now may not be obvious. Am I communicating? Now, but the point there is that when you have that, there can exist variation depending on the patient and the makeup of the patient. There will be variation in the absorption of the growth from the This one is sleeping. From the suppository. Stand up. You. Stand up. Stand up. Stand up. Oh. Pull up. Africa never misses now. Why you get it? Okay. Can I visit them? Email before. Okay. We should. Okay. We should. Ask him how. I met you at all. So what? You say what? Can I leave my class now? Leave, please. Leave the class. You people are not cultured. I'm a photo of Umar Olana, and if you support him in my class, who does that? What type of attitude is this? Please. Even when some issues with how you were brought up, keep it at home. No, keep it there. That's wrong. No, this is wrong. This is a sign of me and Equania. No, take the leave it. I can't be here in your presence. You are attacking a student. Who are you? You make a in my presence. That's wrong. No. That's I don't know. We are ever so. Your friend don't talk, you talk. Or your elder don't talk, you talk. Who are you? Even at my age, they don't talk, I talk. My mother don't talk, I talk. Can I humble? That's wrong. I've seen families, I've seen people that don't have such training. They talk anyhow. Keep it at home. And nobody continue. You did that was sad. That's wrong. I can't be here talking to a student. That's wrong of you. Please, that is very wrong. Let's be cultured, please. It's very, very wrong. You may see it as just normal thing, but it's wrong. You don't know where it's taken tomorrow. It's very wrong. That is very wrong. Now, let's continue, please. I'm going to summarize it. Simple language. It's still simple language, right? I'm using simple language that's simple to use. No. Okay, guys, we can use English. The point I'm making is this. See, if there are a lot of things in this intra. If you like, just Google intra variation, intra subject and intra and intra. It's a different field altogether. A lot of things are involved. But I just want you to know that it has, in summary, it has to do with variation with response to how the drug leaves the water and enter the system. What was that? What say something? You raised your hand before.
So I was trying to grab
Is that what I thought? Maybe you saw something you want to.
No.
Okay. I thought you browsed it or something like that. Okay. So I don't want to start going. Remember, before I did it, I said that I don't want to start going. It leads into a lot of things that a few that entirely works. But just in summary, I bring the one that concerns us. It has to do with, the way in which you, maybe if you have, we have species, right? Even though we are the same thing, the same species, we are Homo sapiens, but we differ in the way, even as that's why you can take this apart from the pharmacology, although it has a lot to do with pharmacogenomics anyway, but basically it has to do with variation. You may be inserted. It may be inserted or you may insert it and may insert it, but the way you respond to it, the way it enters the system may not be exactly what the same thing with my what. Oh, there may be what variation. Am I communicating? Now, because of that, now you are not sure of what will happen. The best is to just leave that one alone and do what? Focus on the one you know that can easily what? Swallow and what? Take. If you Google intra and enter, someone can just check it up. Just check inter and intra variation in species. Inter and what? Intra variation. Let me see what is there. It will take it to a different note together that if we start going into it today, we may not go today. Now, someone should look for proctitis. What is proctitis? Information of where? Good. Rectum, right? Who said that? No. It's not issue of Venus. She has gone through this, and I like it. It's a good thing. I said it. She listened and they pick it up. I intentionally asked what is proctitis. That means she has gone through it. Check it out the meaning. And has someone seen intra and all right, let's continue. So now, person with proctitis, information of the walls. Walls of where? The what? The what again? Tell us again. Rectum, right? Rectal what? Mucosa, right? So now, patient with such inflammation, such issue, do you think suppository is better for is good for the patient? No. Suppository is not good for what? Such a patient. Look for another what? under what? Dosage what? Form that you can use to do what? Administer the what? The drug in question. Now for suppository, apart from this small one you do here, I don't know. Are we doing it? I don't think we have done it before. Do you have suppository mode here? You will find that. But the point there is that large-scale production of suppository is very what? Costly. It's difficult and what? Costly. Am I getting? It gives it's a disadvantage to what? Suppository. So large-scale production of suppository is what? Costly and what? Difficult. It's not an easy process. You can easily do anyhow. Am I because there are a lot of things there are a lot of conditions you will keep. Am I getting? So large-scale production is what? Is what? Costly and what? Difficult. Am I communicating? Costly and what? Difficult. Even the storage, the shelf life may have issues easily because of what? There are stringent what? Storage conditions. I think you put the freeze. Yeah, you need to be up and down. I was going to come. Walk for complete how many days? Our stress, you get to body. True of us. Open that use the drug. If the drug can be formulated as, let's assume if the drug is formulated as, can be formulated as what? Tablet. Can be formulated as what? Syrup and the suppository. And upon every, you find it difficult to even no power, no electric power. You don't even have fridge. Or even if you have no electric power, then you start looking for where to get what? Ice block. You notice that this stress will be like, this suppository is sure weight. It poses what? Disadvantage to that what? Dosage form. You start looking for a way to administer the drug even without using what? Suppository. True of us. So even in such situation, tablet and we go edge. Over what? Suppository. So that's why it constituted what? Its advantage.
Can you say the shelf life will do what?
Okay, now let me ask you. If it has a stringent, you know what a stringent is, as a strict, as in well monitored, different conditions you get used to and the two this thing, all the stressful in the BI pitch. If it has such condition, good morning, Alpha. Let me know. If it has such condition, what? Okay. All right. If it has such condition. What do you think? If you don't meet up to that condition and the storage will issue, what happens to the shelf life? What happens to the shelf life? It will shorten it now. It will shorten the what? The shelf life because you don't meet up to the what? Storage what? Condition. So the storage condition may be that the temperature should be below room temperature. True of course. Very low. Maybe even up to 10 degrees Celsius. True of course. Or even, let's say 10, 15, very, very low. Now, above that, you cannot pick it up. You put it at zero and room temperature, or melt. Or what happens to the shelf life? The drug will melt. So the shelf life will what? Negatively what? Adversely what? Affected. Now, the last but the least is what? Depending on the shelf, this GI state, the state of the GIC. When the state of the GI when the thing was inserted affect the what? Suppository. Am I communicating? The state of the GI, the state of condition of the GI when the suppository is inserted also affect the what? When you say GI, not only the stomach, you talk about the what? The intestine. It's related to part of the GI. Yes. Is it? Yes. So the nature, what is the state on there affect the what? Suppository. Open and sit in here. What did you happen to this suppository? Will it work? Open and sit here. Will it work? Alright, give me your attendant. Let me sign, please.